So what we want to start doing is deconstructing how do we get to those outcomes, so we start doing things on purpose. If there's one thing to take away from today's conversation, is to think about how do we do things on purpose? How do we do things systematically and intentionally? The formula for success, or a formula for success, really comes from the National Implementation Research Network, in which we talk about the importance of an effective intervention. And I think most people can hang their hats on that. Most people can think about what that means. We're very fortunate in human services that in today's context, we really have access to a lot of great evidence-based practices. We also have access to great evidence-informed innovations. One of the places where we're really struggling is really thinking about the effective implementation methods. And just as we have best practices for programs, whether it's multi-systemic therapy, whether it's tips, whether it's motivational interviewing, and so on, we also have best practices for how to implement those. The other thing is that all stakeholders share the same goal. They all have the same frustration that the system is getting in the way of us achieving the results that we want. Every single person. So I think that that's an important thing that I really learned professionally, and really believe that all stakeholders have that same goal. If you unpack all the different things that we have going on, it comes down to that. In early 2000s, the National Implementation Research Network team really did a thorough analysis to start understanding what were the things that worked for implementing an evidence-based practice. And they looked at several different disciplines. They looked at everything from agriculture to banking to health to education to early childhood special education, to see what was it that people were doing and what was it that's working. From these, and from the graph we looked at before, we saw that, having a whole federal department did not seem to make a difference in actual behavior change. We also know that passing laws or mandates, could be helpful, but don't necessarily lead to the intended behavior change. Training alone does not lead to behavior change. And when you think about where most of the resources are spent in terms of professional development, it's typically training, right? If you go to this great workshop and there's a dazzling speaker, and then you're expected to do something when you're back in your office the next day, right? So, and it's almost like, for me personally, I have this shelf of shame that I call it, that I've started from all these great opportunities I've been fortunate to attend, but when it comes to changing my behavior in my practice, it doesn't happen, right? It's not that I disagree with it. It's not that I don't have the t-shirt and the pens. It's really the fact that it doesn't get me to do the work. And that's what we typically spend our money on. That's typically when we think about professional development, by sending folks to, a 1 or 2 day event and expecting something different is not fair. The panelists will talk more into this about how we reinvent the system, and this is my final message, is really thinking about moving away from the notion of operating in these ghost systems, right? We get things done despite the system many times. We want to stop doing that, as painful as that is, and move to creating a host system so that the system supports that work, so that the system supports the efficiency, so that the system is a lever for what we need to get the families the supports that they want. All of this really are the organization drivers, that host system. It's important that we're clear on what it is that we're doing, investing in people. Implementation is not linear, it's messy, like that slide we looked at, but we can create a culture of trial and learning by honoring the work and knowing that we have this network of colleagues that we can turn to.